Hi, I'm Dr. Sue Mitchell. I'm a board-certified gastroenterologist and I practice functional medicine. By really understanding your symptoms, I'm able to make a diagnosis, and more importantly, I'm able to figure out what part of your GI tract may not be working right, and then it helps me dive into the root cause and be able to help you to heal. So when patients come in and they tell me they have gas, I always want to figure out, where are those gas symptoms coming from? Do I think they're coming from the upper GI tract? Do I think it's coming from the middle portion of our GI tract, which is the 22 feet of small intestine? Or do I think gas is coming from the colon or the large intestine? So when gas is coming from the upper GI tract, patients might feel that their stomach is really full. They might feel like they're belching. Sometimes patients will feel like their stomach is rumbling. They may have a little bit of heartburn. If patients are describing gas that's coming from the small intestine, they may say that they just feel like their gut or their intestine is full of air. And so that will present more like their abdomen is distended. They may want to loosen their pants. They just feel really bloated. And then gas that comes from the lower GI tract, that typically is what we call flatulence or farting. And when patients tell me they're having a lot of problems with flatulence, I always want to say that having flatulence can be very normal. So, is it new? Is it excessive? Has it become a problem for you? And also, there can be different odors when we fart. And so I may ask you, does your gas smell like a rotten egg? Or does your gas have no odor to it? So based on the odor of your flatulence, you can actually tell what type of organisms or bacteria are living in your gut and what type of gases they're producing. Sometimes too, when patients have symptoms of gas, we want to know what type of foods trigger your gas. So is it a particular food like dairy, cruciferous, beans, red meat? Do they make you feel gassy? Do you feel gassy when you eat a lot of raw vegetables? Sometimes patients will feel that maybe the raw vegetables aren't leaving their stomach. They may feel like they have gas in their stomach. So it's really important to kind of take note as to what foods might be triggering your gas, because that can be really important to the history as well.